بسم الله الرحمن الرحيم. Pneumothorax. Definition: pneumothorax is the presence of air in the pleural space. Etiological types: spontaneous pneumothorax, which may be primary or secondary. Primary occurs in the absence of an underlying lung disease, and mainly in tall young patients, and it occurs from rupture from subpleural apical blebs in response to high negative intrapleural pressures. Family history and cigarette smoking may be important factors. The secondary spontaneous pneumothorax is a complication of a pre-existing pulmonary disease, as for example, COPD, severe bronchial asthma, rupture of subpleural TB cavity or lung abscess, interstitial lung disease such as sarcoidosis or interstitial pulmonary fibrosis. The second etiological type is traumatic pneumothorax, which may be due to penetrating or blunt trauma, or iatrogenic pneumothorax, which may follow procedures such as thoracentesis, pleural biopsy, rigid bronchoscopy, or mechanical ventilation. The pathological types of pneumothorax: closed pneumothorax, in which there is air in the pleural space with no communication with the atmosphere, as for example, due to rupture of a bleb. Usually there is mild increase in the pleural pressure, and usually it resolves spontaneously as air is absorbed from the pleural space. The second pathological type is open pneumothorax, in which the air in the pleural space with communication with the atmosphere, such as trauma, and inspiration allows air to enter the pleural space, and expiration allows air to go outside the pleura to the bronchus. So there is mild compression of the lung. The tension pneumothorax, which is very important, it is a life-threatening condition. The bronchopleural fistula has a ball valve, that is to say one-way valve effect, allowing air to enter the pleural space during inspiration without escape during expiration. That's why there is an increasing air in the pleural space, which develops over time and leads to increasing intrapleural pressure and compressing the lung and the adjacent structure. And it's in an emergence case need immediate intervention, usually in form of ICT, intercostal tube. Clinical picture. Symptoms of pneumothorax include chest pain, which is usually sharp unilateral pleural pain, and there is dyspnea, dry cough, and if there is tension pneumothorax, the shock will present. Signs of pneumothorax: general signs. If the simple pneumothorax, will find tachycardia or tachypnea, but in tension pneumothorax, there will be cyanosis, hypotension, and severe respiratory distress. Local signs: there is no signs in mild pneumothorax, Inspection: the shape of the chest, there is the unilateral bulge, respiratory movement diminished on the affected side, and in palpation, the trachea shifted to the opposite side, especially in tension pneumothorax. Tactile vocal fremitus will be decreased. And in percussion, there is hyperresonance on the affected side and tympanic percussion in tension pneumothorax. By auscultation, there is decreased or absent vesicular breath sounds. Investigations of pneumothorax include radiology, chest X-ray, we will find distinct visceral pleural line and absence of lung markings, lung markings outside this line. That's to say jet black. We may find collapsed lung or depression of copula of the diaphragm, and the costophrenic angle is abnormally deepened when the pleural air collects laterally, producing deep sulcus sign. There's mediastinal shift to the opposite side. If the pneumothorax is very small, we can find the rim of pneumothorax only on expiratory film. The CT can be used also to detect pneumothorax. Other investigations, which are additives, such as blood gases, there will be hypoxemia and hypocapnia according to the severity of the pneumothorax. Treatment of pneumothorax depend on the severity of pneumothorax and the nature of the underlying disease. A small pneumothorax below 20% of hemothorax often resolves spontaneously, just symptomatic treatment or supportive treatment. If the pneumothorax is severe, may need aspiration and intercostal tube insertion. The chest tube is placed under water seal drainage and suction is applied until the lung expands. Indications of intercostal tube in pneumothorax include tension pneumothorax, large pneumothorax more than 20% of hemithorax, recurrence of spontaneous pneumothorax, bilateral pneumothorax, patient on mechanical ventilation, and severe manifestations such as severe dyspnea or severe hypoxemia or shock. That's all. Thank you.